Radiogenomics is the new omic space in which we use imaging to connect with traditional genomic and other omic sorts of science. In other words, using imaging to predict gene expression, protein expression, mRNA expression, etc. Yeah, so radiogenomics is a very important aspect of doing advanced imaging analysis. One of the keys in any clinical trial is to really try to get as much information as you can from the patients who are enrolled in these clinical trials. One thing that is for certain is that everybody who has cancer always gets an image. And imaging is really a digital media that has a lot of high information content. So by extracting various features of tumors, how they appear, their texture, their behavior before and after treatment, one can often use that information to associate with all variety of responses, whether it is a traditional response of a shrinkage in size or a response that is based on developing resistance to certain drugs and therapies. One of the methods that we use when we do radiogenomics is really to look at a set of images prior to treatment, come up with common features that we see in tumors, and then cluster them into different buckets, if you will. Follow how those features change with response and integrate that change with other information, whether it's laboratory data, clinical outcomes, or other genomic sorts of analysis, including various forms of molecular profiling. Breast cancer, what we have done, in particular as an example of radiogenomics, is we've developed certain signatures that look at things like hormonal status, proliferation status that match or mirror various tests like the Oncotype DX. And using those signatures, we're able to divide patients into those who are positive for those signatures as well as those who don't have those signatures. And that becomes a very important feature. If, for example, you are trying to use a drug that is important for breast cancer in a certain area, then we can really help select patients who would more likely respond to that therapy. This is only the beginning, and what we're doing now is exploratory, but we believe with a lot of standardization and validation will be common practice in clinical trials. Well, it's a new field, and we've had several successes, particularly in glioblastoma, in lung cancer, in breast cancer, and in pancreas cancer, just to name a few. Again, it really is an adjunct tool. It's there to help inform what's happening during a clinical trial with tumors. And it really is a great way of measuring every tumor in one's body by using imaging and looking for how areas such as heterogeneity and different areas of tumors can respond differently to therapies. Technically, it can be done on any image from MRI to CT to PET scans. Ultrasound's a little more difficult to do it on, but we've also done it on X-rays and mammography. In traditional methods of evaluating tumor response, we're usually looking for tumor shrinkage. And when you see tumor shrinkage, that's usually a good indication of drug efficacy. However, particularly in the age of targeted therapies and immunotherapies, tumors don't shrink when they're responding to therapy. So radiogenomics can be one of those methods that help measure tumor response in non-traditional ways. The application of radiogenomics goes beyond clinical trials. One validated, we believe that this will be a useful tool clinically. So we can envision a day when an oncologist will have their patient with cancer have a radiogenomic analysis by their local radiologist. That will then inform which treatments may be best for that patient. Since it is a new science that is developing, it's not available. One of the areas of expertise in our core lab and working with other collaborators across the country and across the world is really to begin to make this more available to other places, institutions. And we're seeing a groundswell of interest, both from radiologists and oncologists alike. The important thing is that imaging plays a central role in drug development, and using traditional markers of response such as RECIST are important, though it's not the entire story. Using a radiogenomics approach also adds information that otherwise could be used in a positive way to help further develop drugs in clinical trials. I think that one of the remarkable things about the TAT conference is putting together a group of experts in all phases of the clinical trial, from oncologists to radiologists, to really help solve a very important problem in clinical trials of how do you know when a drug is working.